In a world where battles are not always fought on the battlefield, there exists a silent enemy that lingers within the shadows of the mind. Welcome to the front line of post-traumatic stress disorder, where the battle scars are invisible yet profoundly real. As defined by the Diagnostic and Statistical Manual of Mental Disorders, PTSD stands for Post-Traumatic Stress Disorder. It is an anxiety disorder triggered by exposure to actual death, the threat of death, serious injury, and sexual violation. PTSD changes how the brain works. Firstly, the part that deals with fear, which is the amygdala that controls the feelings, becomes too sensitive, making even small reminders of the trauma feel overwhelming. Then, the area that handles emotions, the prefrontal cortex, struggles to keep things in check, making it hard to control feelings like anger and guilt. Lastly, the part responsible for memories, or the hippocampus, might shrink, making it tough to process what happened. These changes lead to symptoms like nightmares, flashbacks, and difficulty with relationships. Overall, PTSD makes life after trauma really tough. The lifetime prevalence of PTSD is about 10 to 12% in women and 5 to 6% in men. There are similar differences between the sexes for disorders such as major depression and anxiety disorders. PTSD subcluster scores have been found to be increased in women for re-experiencing an anxious arousal. Men and women experience different types of traumas, both in private life and at work, with women being exposed to more high-impact trauma than men and at a younger age. In the Philippines, PTSD rates vary, with factors like ritual genital cutting and displacement affecting prevalence. Studies show that among boys in Batangas province, 69% who underwent traditional cutting and 51% who had medical circumcision exhibited PTSD symptoms. There are many ways the body may respond to a traumatic event, and everyone responds differently. There are 5 types of PTSD. Normal stress response is what occurs before PTSD begins. However, it does not always lead up to the full-blown disorder. Acute stress disorder, while not the same as PTSD, can occur in people who have been exposed to what is or what feels like a life-threatening event. Uncomplicated PTSD is linked to one major traumatic event versus multiple events, and is the easiest form of PTSD to treat. Complex PTSD is the opposite of uncomplicated PTSD. It is caused by multiple traumatic events, not just one. Comorbid PTSD is a blanket term for co-occurring disorders. It is applied when a person has more than one mental health concern, often coupled with substance abuse issues. PTSD happens when someone goes through a really scary or shocking event, like a serious accident, war, or violence. Their mind and body react strongly to the experience even after it's over. Many risk factors influence whether or not a person develops PTSD after experiencing a dangerous incident. Some of these characteristics exist prior to the trauma, while others emerge during and after the incident. PTSD isn't just a condition, it's a life-altering experience. It can affect every aspect of daily life, from work to relationships. Recognizing the symptoms is crucial for understanding PTSD. They often manifest in 4 main categories: re-experiencing symptoms, avoidance symptoms, arousal and reactivity symptoms, and cognition and mood symptoms. Thoughts and feelings can trigger these symptoms, as can words, objects, or situations that are reminders of the event. Flashbacks, recurring memories or dreams related to the event, distressing thoughts, physical signs of stress. Avoidance symptoms may cause people to change their routines. staying away from places, events, or objects that are reminders of the experience, avoiding thoughts or feelings related to the traumatic event. Arousal symptoms are often constant. They can lead to feelings of stress and anger and may interfere with parts of daily life. Being easily startled, feeling tense or guard or on edge, having difficulty concentrating, having difficulty falling asleep or staying asleep, feeling irritable and having angry or aggressive outbursts, engaging in risky, reckless, or destructive behavior. Cognition and mood symptoms can begin or worsen after the traumatic event. Trouble remembering key features of the traumatic event, negative thoughts about oneself or the world, exaggerated feelings of blame directed toward oneself or others, ongoing negative emotions such as fear, anger, guilt, or shame, loss of interest in previous activities, feelings of social isolation, and difficulty feeling positive emotions such as happiness or satisfaction. Fortunately, there is hope. Assessment, treatment options, and coping strategies are available to help individuals reclaim their lives and find healing. We have the Post-Traumatic Stress Disorder Checklist, a standardized self-report rating scale for PTSD comprising 17 items that correspond to the key symptoms of PTSD. It is a list of problems and complaints that clients sometimes have in response to stressful life experiences. The clients indicate how much they have been bothered by a symptom over the past month using a 5-point 1 to 5 scale, circling the responses from 1, not at all, 2, a little bit, 3, moderately, 4, quite a bit, and 5, extreme. Treatment for post-traumatic stress disorder typically involves a combination of therapy, medication, and self-care strategies. It focuses on changing negative thought patterns and behaviors related to trauma. It helps them regain control over their thoughts and feelings. Techniques like relaxation are used to manage anxiety. Is a focused CBT therapy for active duty military personnel with PTSD. It includes exposure therapy and the empty chair technique from Gestalt therapy, where participants express themselves to anyone, living or deceased. Is effective for both rape survivors and combat veterans with PTSD. It's a structured therapy focusing on challenging erroneous beliefs like guilt and self-blame. Participants read aloud their traumatic experiences, identify generalized thinking patterns, and develop more balanced perspectives. It uses bilateral stimulation to process traumatic memories and reduce their intensity. Antidepressants like sertraline, paroxetine, and fluoxetine are commonly prescribed to help manage symptoms of PTSD. Sometimes prescribed to help reduce nightmares associated with PTSD. Physical activity can help reduce symptoms of PTSD by releasing endorphins and improving mood. Eating well-balanced meals, avoiding alcohol and drugs, and getting enough sleep are important for overall well-being. Practices such as mindfulness meditation, deep breathing exercises, and progressive muscle relaxation can help manage stress and anxiety. Building and maintaining relationships with supportive friends and family members can provide invaluable emotional support. Post-traumatic stress disorder may cast a long shadow, but it doesn't define who you are. With awareness, understanding, and support, recovery is possible.
Together, let's break the silence and